Here today to talk about contagious content with several guests that I'm really excited to introduce here today. But before I introduce them, I'm just going to summarize what contagious content is to me, and then I'll let everyone else redefine it. Content comes in many shapes and forms, and it can be used in a lot of different ways. I think what makes it contagious in my definition is when the content is good enough that people want to share it, that they want to go back and return for more. So with that as my definition of contagious content, I'm going to start with Brian and ask him to introduce himself. Each of our guests will introduce themselves, tell a little bit about themselves, and tell what makes their content contagious. Brian?
Thanks, Kathy. So I'm Brian Ahier. I'm at Ahier, that's A-H-I-E-R, on Twitter, and then I also write a blog. And my day job, I'm the health IT evangelist at a health system, Mid-Columbia Medical Center, and then also the president of Gorge Health Connect, Health Information Exchange. And I like your definition of contagious content. One thing that I think is really important is having content that is useful in real life and relevant, but also that's sometimes fun. So, you know, every once in a while, I don't do it often, but every once in a while I'll go and look at the Bitly analytics tools. bit.ly is a shortening, URL shortening device, and it gives some pretty good free analytics where you can see how many people are clicking on links. And then, of course, you can always tell from SlideShare and YouTube and other social sharing sites, whether it's whatever type of content. And then also on my blog, you can see how many people are clicking on things and how many people are viewing things. And most of the time, the most contagious content that I provide is usually around what the federal government is doing. So I've, over the years, set up some pretty good RSS feeds and kind of alerts that will let me know when, for instance, something's on the Federal Register, on the Public Inspection Desk, and, you know, I read through that and I post some content about it, kind of almost breaking news style, and tweet about it and blog about it. And that seems to be the most contagious and widely shared types of things. But then a few times, for instance, there's a Seinfeld episode where Elaine is a difficult patient and Kramer goes in and tries to steal her chart, and it's hilarious, and it also really speaks volumes about the broken healthcare system that we're all trying to thrive in. And so sometimes even, you know, humorous and sarcastic content can be pretty contagious. And with that, I'd like to hear from the other folks, and we can have a pretty good discussion, I think.
Thank you, Brian. Lee Aase, would you like to go next?
Sure, that'd be great. So my name is Lee Aase. I'm the director of the Mayo Clinic Center for Social Media. And I have sort of two different kinds of content that I would consider contagious. One is highly targeted and highly relevant, and it's contagious within a very small group. So these would be some of the videos that we might do with our some of our subject experts. They're among the leaders in their field in the country, around the world, dealing with their particular issue, and especially in really narrowly targeted conditions, maybe rare diseases. Their content becomes highly contagious within the groups of those people that congregate online, people who have a particular concern. And so that actually can be relatively long. We can do 10-minute videos that are really pretty contagious within that small group. Then on the other hand, we've had some other content that is just fun, as Brian mentioned, and with suitably short to go with the attention span of fun, and so that tends to make it. I think, especially if you're going to be dealing with public health type of messages, it has to be a little bit fun to get the traction you need.
Patricia, would you like to introduce yourself, please?
Okay, well, my name is Patricia Raymond. I am a physician as my day job. I'm a gastroenterologist, and I'm a speaker. I speak to healthcare audiences about kind of reclaiming your passion and joy in medicine. But my big mission is about health literacy, and I like to do it with humor because I think that that's what makes it contagious. That's why somebody sends it along. It isn't good enough to just be a really great article about colon cancer screening. It has to be something funny. So My alter ego is a character named the Divine Miss Butt Meddler, and I do kind of music videos, parody music videos about colonoscopy and about colon cancer awareness. And one of the other things, not only adding the humor, making things contagious, but I'm kind of one of those repurposers, reusers. I write things and then reutilize them in every possible way I can think of using them, whether it's in printed media, whether it's on every single social media site. I kind of reuse everything. I never do it only for one purpose. So I think Contagious in today's world is not just good content, but it has to do with humor. It has to have a lot of humor to be passed along. And that's me.
Thank you, Patricia. Val, would you like to introduce yourself?
Sure. I'm Dr. Val Jones. I'm the founder of GetBetterHealth.com. I've been blogging since 2006, and I've been involved in social media since then. I'm a physical medicine and rehabilitation specialist, and I work part-time at Virginia Hospital Center in Arlington, Virginia, though I am based now in Charleston, South Carolina. In terms of what makes content contagious, I think it probably, besides being a cat video, I would agree with what everyone else has said so far. What I try to do, I think, is to add something new to a conversation, maybe by relying on either my medical training or the medical training of those who blog on my site, to try to give people insight into breaking news, into science, health stories, really just trying to provide something that they don't get from CNN, for example. And so I think that makes it contagious. Also, I agree with Pat that you really need to connect emotionally with people, and humor is one of the best ways to do that. So I always speak from the heart when I blog and talk about, how I can relate to people's experiences in hospitals. I've been a patient. I've had family members who've been patients, and I think that helps to humanize the whole experience to try to make the healthcare system better. So those are just a few little thoughts about contagious content from me.
Thank you, Val. All of you have touched in some way or another that there is an emotional connection, like Val said, with content really striking a chord with people, whether it's with humor or it is an emotional connection of someone going through it, or the desperation of looking for an answer and finding it, or the excitement of the instant news story. So what I'd like to do is just open up to discuss what do you think that are the components of good content in general?
For me, I think the keeping it relevant, and current. So the worst thing I think you can do is to keep reposting the same content to try and bump up page views. That might be effective in some respects for SEO and optimizing the number of views you get. And maybe if that's what you're in it for and you just want to get ad-generated revenue from a website, that's great. But I really like to have relevant content and not be sort of spammed on, whether it's on Twitter or Google Plus or Facebook or through email. I've got great spam filters on email, and I'm starting to figure out how to filter out some of that stuff through some of the other sharing platforms as well. I think that staying relevant and timely is important.
That's a big job, though. Don't you all agree that in order to find good, relevant, timely, to write all the material, to find the material, to get the ideas for the material, it's overwhelming. How do you do that?
A big part of what we try to do is to not focus on overproducing, actually just to focus on the content itself and the message that we're trying to get across. And certainly with some of the funnier stuff, it takes more production, more thought to make it work. But from our perspective, the subject matter experts that we have have something that's really precious that people with a given condition would like to have access to. And so I'm not talking about this really in the public health perspective, because people don't care about their health until they're sick, is kind of what it comes down to. At least fundamentally, they're not going to spend the time to get more engaged, unless you're giving them something that's going to be rewarding to them in some other ways, and that's where the humor comes in.
Say that great content is brief in general. It should be no longer than it needs to be to get the point across, especially in this Twitter world where people have the attention span of 140 characters. That's all I have to say.
And I do think we have to be very aware in medicine that our stuff is not evergreen, that it really has to be rotated off. You have to take it off the site, especially when it's no longer accurate. But, it just can get so stale and be wrong information. And I think that's one of the dangers where you're writing about just about anything else. It can be historical. But when you get into medicine and you have it old, it can be wrong. It can be misinformation. There's so much bad information out there. It's our job to make sure there's good information out there.
That's a good point. I'd like to know, what are each of you trying to accomplish with providing content?
It's funny. I don't know why I do this. It's not part of my job. Clearly I'm having fun, right? And that's part of it. Sunday evening, I'm sitting around. Wait a minute, I've got to have this will be my moment where you do the long reach off over. And gosh, I'm thirsty. This message is not brought to you by my local microbrewery. So you have to have fun, right? So I have a good time doing this. I've always been kind of, Val brought up the point that it's this hyper-connected world where, we all seem to be suffering from ADHD and OCD, and kind of riffing off what she said. I guess I seem to have a knack for being able to condense things down into digestible small bites, and so Twitter has worked well for me. But I actually, the last 6 to 9 months have really been using Google Plus a lot more, and the reason why is because I'm not limited to 140 characters, and I can do more long-form posts, and I can respond. And you can do it's sort of like in between Twitter and Facebook. Facebook has been great for that, but Facebook is more my personal space. So, I put health IT things on there and healthcare related things, but it's also where my family is. So Facebook is a little bit more personal, and I think we'll probably get into some of this because we have, healthcare experts on the panel here, and you've got some physicians on here. But, when you start to blur that line between your personal life and your professional life, it gets difficult. For me, it's a little easier because none of the things I do in social media are related to my employer or my work. So I'm kind of free to do it. It's a hobby for me, so I do it as a hobby, and it's fun. And the minute it stops being fun, I stop doing it.
A lot of what I do is for work. I mean, I got into this related to work. My original work was media relations. It was about telling stories about research advances happening at Mayo Clinic, studies being published in journals, presented at meetings, or else patient stories with the appropriate consents, HIPAA-compliant consents. We were pitching those stories to journalists, and some of creating the content at first was as a way to better do that work, to make the, instead of me picking up the phone and calling journalists, we'd be able to reach them in other ways and show and tell, particularly through YouTube videos and unlisted. We subsequently kind of leapfrogged that and said it's great for that, and we continue to use these tools in the media relations world, but we have an opportunity to really Brian showed a micro brewer, and we do micro targeting, and it isn't really targeting in the sense of keeping lists of people who get access to content. It's putting content in a way that they find it themselves. And so from an awful lot, this isn't the only reason for creating content, but a big chunk of how we got into this in the first place was that you can't, and with all due respect to the people who say it needs to be short, it's good to be short. And don't make it any longer than it needs to be. But on the other hand, I mentioned earlier that people don't care about their health until they get sick, and then the other side of that is once they get sick, they're looking for everything they can find on the topic, especially if it's a rare condition or a serious, potentially serious condition. And so we find that unhurried provision of in-depth content is something that actually meets our needs, and it meets the needs of the patients and prospective patients. Because for one thing, about 25% of our patients come from more than 500 miles away, and one thing that they have to pass an awful lot of good providers on the way to coming to see us. And so if we can help them to build a little rapport, get to know the physicians who have that expertise, it gives them the confidence, I think, that hey, maybe this is a place that I should try.
Lee, I just want to let you know also, I get to travel around a lot, being the health IT evangelist, and I'm fairly well known in social media circles, and I get asked a lot by healthcare organizations and companies, vendors, and all over the place about policies and procedures, whether it's a small physician clinic or a large, very large healthcare organization. And I always point them to Mayo Clinic. You guys have been open and transparent about your strategy, and you have great resources available for other organizations that kind of want to pull in some of that information and develop their own strategy and their own policies, particularly in the policy arena. So thank you for sharing all of that with the community.
Thanks, I appreciate that, and that's actually something that I'm pretty jazzed about, that our leadership is behind that they really fundamentally see these tools as things that should be harnessed for healthcare, that we should be not just using them in the PR and marketing sense, but how can we use them to connect with patients, help patients connect with each other, and just to improve the delivery of care, contribute to medical research, use them in patient education as well as provider education. And so I just feel very blessed to have that leadership buy-in and that leadership mandate, I guess, to help other organizations that want to move along in this area too.
I'd like to second that comment. I really admire the stuff we get online from Mayo and the information that's out from Mayo, because what we obviously have going on in our society right now is really crummy health literacy. And we have people who, as you said, when they get sick, they really want to have a lot of information, and they go online and get this information that's just not vetted in any way. We've got to educate our patients how to actually be literate in health. I want my patient who comes in to be an educated consumer. I love when they come in with a sheaf of papers. They printed off the Mayo site and they said, I think I have diverticulitis and here's my information. I hate it when they come in having not thought about it at all. So I really think that no matter how the patients want the information, most of them now have a computer. They're not going to their library. They're not asking the reference librarian. They're wandering around on the internet. And we've got to make good information available that's understandable to allow them to be good consumers. Otherwise, the healthcare costs are just going to keep skyrocketing because nobody has any knowledge of how to be healthy out here.
I just wanted to add to that as well, Pat. One of my passions is health literacy too, and I feel I take it to the next step, and that is that I think physicians are we almost have a moral imperative to get online and to provide good information, because if we don't, for example, in the vaccine world, the Jenny McCarthy's of the world will win. If people are Googling, vaccines, and they come up with, Jenny McCarthy, and, you're going to cause autism in your children if you give them a vaccine, and all this misinformation, it can actually bring back the measles, and so I think it's really important for as many of us as possible to get online and get good information out there, because unfortunately loud wins. And what I mean by loud is just the number of times people hear things, it seems to, it becomes true for them. So, the more physicians and scientists and people who have evidence-based medicine as the foundation of what they do that get online to try to get that good information out there, whatever the platform. I'm absolutely all for it. And the other thing I would just say, what motivates me to blog and to be online, besides health literacy and developing critical thinking skills in the public at large, is just to explore the possible uses of social media and to kind of push the boundaries. I can give an example that was kind of neat. I have a blogger who contributes to Better Health. His name is Dr. Paul Auerbach, and when the earthquake happened in Haiti, he was one of the first physicians on the site, and he ended up, being the head of emergency medicine in Port-au-Prince over all of the NGOs and everything. And he actually Skyped in to my website and provided information about what was needed on the ground. The American College of Surgeons used this information to create a database so that in the future, the first wave of response could have more useful supplies for earthquake victims. And so that was a really neat use of social media, and always looking for new ways to do projects like that.
While we were talking, we have another visitor that was able to make it a little bit late. Todd Hartley, welcome.
Hi, everyone. Really excited to be here.
Would you like to go ahead and tell everyone a little bit about yourself and what type of content you typically produce?
Sure. Well, let's see. I create a little bit about me. I guess I'll start with the beginning of the question. I have a digital marketing agency in Scottsdale. We specialize in healthcare marketing, and I think it's contagious healthcare content. So what we do is we create campaigns that revolve around certain conditions. An example is our breast cancer campaign, Breast Cancer Answers, which we created a library of 640 video answers to audience questions. Questions are all non-case specific. And in the last year, that content has generated 6.3 million video views. And so what we did is we put remote cameras in each of our doctors' offices, and we create the content either in a Google Hangout and bring the audience to it, or we create the content in a non-live environment, and then people just engage and share around it organically.
Thank you, Todd. We're going to pick up here now, and we're going to get a little more into the nitty-gritty, because I think what people would really like to know is, are you seeing a result that is worth the time and effort? And the other question that I'm going to throw out there at the same time is, what are the biggest obstacles, the biggest struggles, or the biggest problems that you have to overcome in either producing or responding to or content, in however you want to address this question? Let's just open the floor.
Let me start with one of the biggest obstacles, and that's the need for sleep. I think in the 24/7 media cycle that we're in, and the constant shifting landscape that we're faced with in healthcare these days, it's a huge job just to keep up, just to keep current with what's going on. So, fortunately, I don't get a lot of sleep, and so I'm able to, and then I wake up in the middle of the night with an idea, and I look things up on the internet, and so I might tweet at odd hours. But I think, really it's a big job, and it's a 24/7 job, and that can be a challenge sometimes.
So I'd also just say that one of the ways to, in terms of content, to be able to show the best results, a little phrase I don't know if I popularized it or not, but I've tried to, is that as I approaches zero, ROI approaches infinity. That if we can keep the cost of producing the content relatively low, that it doesn't take a huge kind of astronomical mega viral hit for it to be worthwhile. That is, we're creating content where we're asking a physician to talk for 10 or 15 minutes, and we do edit it down somewhat from that, but talk for 10 or 15 minutes about a particular rare disease or condition. That if we're shooting that with a $150 video camera, and yeah, it's taking their time, it's taking our time, no doubt about that. But what I would consider the break-even point on that video might be 300-400 views. because what he or she, what the physician has been saying in that TV, or what would be a TV interview, but that would never be compelling enough to get on TV, actually reaches the people who need it, and it also, we find it helpful for patients in aftercare, or when they've gotten a diagnosis, for them to be able to go home and share with their family and friends more about what that condition is. I think that we definitely have what I would call anecdotal or biopsy evidence that shows payback, real financial payback in some of these areas. We haven't been able to do it in a comprehensive way just because we've got something like 2,500 videos on our YouTube channel, and so we can't track them all, and we can't isolate the effect on all of them. But certainly we can see that it's making a real difference for patients who report to us the role that having a video like that played for them in coming to see us, but also people not at Mayo Clinic, never become our patients, that are able to use that to have conversations, to start conversations with their physicians. So, I mean, we definitely see the payback on that in both financial and non-financial, more important terms.
Lee, one of the things that we did is we created a tool that allows our physicians to send specific videos or customize the videos that patients get back after they get initially diagnosed. So when they leave their diagnosis, the physician can then email that kind of a quick rundown of little 2-3 minute video clips to the physician, and then the physician can then share those with their loved ones. They can study and learn about before they come into the second meeting. And I think the biggest impact that our physicians have seen is that the patients demand more time than the physicians can supply, and so we automate that process by allowing the physicians to speak on video and educate the patients on the patient's time while the physician's continuing to see more patients. Does that make sense?
Yeah, it sure does, and that's something that we maybe aren't as far along in the formality of that, but it definitely makes a lot of sense that there are, one of the things that's frustrating for physicians, and somebody mentioned earlier the Jenny McCarthy thing and the autism
right.
Discussions, that if we, if they have that same conversation over and over and over again, but they're, people like Wendy Sue Swanson and others who are putting out good videos, and it's good to hear your doctor talking about why they decided to vaccinate their children. And I mean, that's just one example, but we definitely are exploring and running some pilots with that, and looking at things like heart failure, because if we can help reduce readmissions, promote compliance, answer questions, and get the whole family, whole extended support network involved, and make sure there is sodium in that pizza crust that you're, Dad, you gotta watch the sodium. Those kind of things, that'll be really helpful.
Did anybody else bring any props with them? Because I don't know, that seems very unfair.
Well, you missed the beer.
Yeah. Oh, really?
Yeah.
You had beer earlier.
My great microbrew. Both Todd and Lee kind of alluded to the physician responsibility almost, in a sense, in the new social structures that we're building. So, it used to be that I'd run into my doc at the grocery store or what have you, and now instead I sometimes run into colleagues on Facebook. And there is a lot of misinformation. And you mentioned the whole Jenny McCarthy thing and autism and immunizations, and I agree. I think Wendy Sue, Seattle Mama Doc, has done a great job on her blog at putting out good, accurate, valuable information, and Val and Patricia have as well. And I'd love to hear from them as physicians, based off the things the three of us guys have just said. You guys as docs, how do you view this?
I wanted to hear more about what the program is that Todd's doing, because currently when you have a procedure done, I send you a letter in the mail. I say, we took out 5 polyps and you have diverticulosis, and here it is all in writing. But I would love to hear more about, you send links to videos where the physician waxes poetic about polyps or diverticulosis or a high fiber diet, and you say, click here, click here, click here. Is that how you do it?
No, what we did is we built a physician reply service. And how it works is before it's deployed, we set up an interview with the physician or with all the physicians in the department. And we capture the frequently asked questions. The frequently asked questions then get built into an online template. And we built a encrypted account where the medical assistant logs in. By the way, taking it back one step, the physician, when he meets with a patient, he has a clipboard. And that clipboard, Matt has all the videos that he has available at his disposal. So when he meets with a patient, he diagnoses a patient, he checks off on the form, stage 1, needs a mastectomy, chemo, radiation, really checks off the available video boxes, hands the sheet off to the nurse in his clipboard. The nurse logs into the encrypted account, checks the relevant videos, and a form letter gets populated when they click send, and it sends off an email to the physician. I'm sorry, to the individual patient. It's a customized education tool that comes directly from your physician to, if you're the patient, to yourself. And it's an addition or an enhancement to the education process that happens during that 7-minute magical window when you're diagnosed. And in 2008, I was diagnosed with a cardiac arrhythmia. And I thought I was going to die when I left the doctor's office. All I heard was that I was going to have surgery. So I knew that I retained only about 10% of the information the physician told me about. Now, as healthcare marketers, this is a huge problem that we deal with on a daily basis because physicians have 7 minutes to explain something. Patients are just dealing with the trauma of being diagnosed with something, how they're going to tell their family, so they're not retaining a lot. So how we continue that education process when the patient gets home and the care that the physician puts into that process is essential. So what we're doing is we have a couple hospitals right now, we just finished it, and we're able to see in our database, we built a tool that helps the physician protect themselves from informed consent issues. So you would be able to see when the patient opened that email, which videos they watched, how often they watched those videos, and then they get a reminder 24 hours before their next appointment to look at these videos, because now in the second meeting, instead of the physician spending the time re-educating or cleaning up misunderstandings, in that second meeting, we're now talking about strategy. And that creates a completely different environment.
So I think that's just kind of an interesting thing when you talk about, we were talking about the 140 characters and the short attention spans, and then we hear about the 7-minute doctor visit, which isn't the patient's asking for 7 minutes. It's just the way, the time crunch is happening.
That's right.
So actually, I think that kind of reinforces maybe a little bit of what we were talking, actually what I was talking about earlier, that our videos can be a little longer. I mean, the 2 to 3 minute videos are great. And again, it depends on what the topic is, but if you're thirsty for a particular kind of information, like I'm sure with your cardiac arrhythmia thing, you wouldn't have been too bothered if you had a 9 or 10 minute video versus a 5-minute video, because you're looking for that reassurance.
Absolutely right.
I think there's sometimes a bit too much of an emphasis on these bite-sized morsels that we want to put out, and I agree. Your YouTube video, 3 to 5 minutes, and let's put it in segments rather than putting it all out as one thing. But actually sometimes I've had a let's just see what happens kind of attitude. For instance, recently I saw little snippets of a Walter Cronkite 21st Century Home video in different places, all from the same source, but little 3-minute clips of it. And so I thought, well, why don't we just put the whole thing out there? And, because I watched it on my big screen TV, I thought it was fascinating to see what in 1967 they were predicting the technology would be like in 2001. And I thought the whole thing in context was better. And so I posted that on my YouTube site this week, and it's one of the, I'm not a big YouTube guy, but that video's gotten almost 5,000 views already, and it's a half hour long. And I think sometimes people are craving for more rather than, always trying to customize the content to these small little snippets. I think sometimes we might be leaving out too much. And, 400 views, if that's where you start to see your ROI in terms of maybe that's the impact we're having, that's great. But as you know, Lee, from the stories that you get, really, if there's 10 views and one of those has changed someone's life and really helped them in their journey through this healthcare system, then I think it was worth it.
That's so true. Okay, I have to give my perspective as the end user. It's really nice to be able to get good comprehensive information where I can sit at home and watch it or listen or read it or however I'm absorbing it. It doesn't always have to be short. You're right, Brian, that if you're trying to get one of those viral videos that's entertaining and you want to share it all over Facebook, that's one thing. But if you're trying to get good information that you can really understand and explain to your family members in the case of something more serious and you're trying to pass along that information and you don't understand it all yourself, you really do need more information than just a little snippet. Well, I hate to admit it, but our time is running out today, and I feel like we just got started. So on the sidebar, I said, I need another hour with you guys.
Right. Well, don't we still have 15 minutes left?
Well, we normally go till 8:45, but if all of you are willing to go for the remaining 15, I'm willing. I try not to invade on Pix and Tweet Chat, but that doesn't start till 9, so let's go on if you're all right with that.
Well, the thing is, I'd love to hear from Val because I remember a few years ago seeing what she was doing, and I was really excited about what Better Health was doing in social media and healthcare. And, here a few years later, I'd love to hear what her perspective has been through all of this.
Oh, wow, thanks. Well, Kathi just a few minutes ago said, what is your biggest challenge? And I think in my case, which is the case for independent bloggers, the biggest challenge is trying to find a way to support what you do, because I'm not backed by an institution or an organization. It's just sort of goodwill on the part of physicians and nurses and scientists who want to contribute to the conversation. And I found that the biggest challenge for me has been just figuring out how to keep the lights on at Better Health, for example. And we've had to significantly downsize, unfortunately, even though I think the ROI, so to speak, was high in terms of touched lives. It was just impossible to grow to a certain size and fund it with my clinical salary, frankly. So this is the thing that I have not been able to solve. And if you guys have any ideas, I would love to hear them, because the biggest problem with trying to provide comprehensive, intelligent content written by experts is that it takes time and it's costly, and if it's not reimbursed by anybody ever, then doctors just have to go back to their clinical work full time, and they just don't have time to do this kind of thing in the long run, unless they're at a hospital or an institution that's allows them to do this as part of their academic work. So that's my biggest challenge, and I'd like to just put it out to you guys here, if you have any thoughts about that.
I've actually heard the same thing from other physicians who are kind of stretched to the limit, where this is a passion of theirs and it's something that they like to do, but that it takes time, resources, and money to make it happen. And my only answer to that would be it'd be really cool to get some sponsorship towards some of these efforts from healthcare payers, from pharmaceutical companies, people that have the deep pockets, some of the vendors that would say, hey, this is valuable, and let's support that.
There was some conversation that took place on Hicksum Tweet Chat last Sunday that a sidebar conversation was happening about this very thing, and someone said, well, why can't we expect people to pay for our content? We're the experts. We're not out there putting out the bad stuff. We're putting out the good stuff. And if you can download a song from iTunes, why can't you download an article from a physician? And that was a very interesting concept to me. It didn't seem very realistic, but I understand where it came from.
I do too, but information yearns to be free. So I think that kind of paywall model is not sustainable. I think a sponsorship or a subscription-based model is better.
Yeah, and unfortunately, people who are selling something tend to be able to support themselves. Magic coffee bean purveyors and people who sell snake oil and things like that are doing just fine. But those who are really trying to correct the record and get good information out there are just really trying to scrape together, people who can volunteer to give their time to do these kind of things. And I just wish that that maybe some corporate folks would see the value in getting good information out to patients and to the internet at large, I suppose, to sort of, as I mentioned, sort of bump down the Jenny McCarthy type sites from the top Google search when people look on for various topics, and then let the people write what's true, because when you get sponsorship, then there become some expectations about what you talk about, and then you need to sort of try to find a way to promote their product or whatever, and then it spoils it. So it's really hard to find someone who will do good for good's sake and not necessarily force you into a position where you have to promote something that may be an overemphasis, even if it's a good product. So it's a really difficult line to walk, I think.
It definitely is a difficult line to walk. We've been lucky with Breast Cancer Answers that we've got a sponsor that wanted to help us get out there and help create awareness, and they have allowed us to do our effort, and still they provide zero editorial oversight on it, which is, I would say, probably very rare. We needed money to get out and do the things that we needed to do, just like Val was mentioning, in order to make it sustainable. And I think there are companies, it took us a good 12 months before we could find a sponsor for it, and it was an enormous amount of pain. But there's a lot of different ways that these campaigns or content can be created by physicians without needing a lot of staff and overhead. And I think Hangouts on Air is probably the best tool ever, because a physician can host in a very specific HOA, and then that content can automatically go into his YouTube channel, and then you can create channels by specific topics. So there really isn't a need to hire anybody to repurpose or to cut up, because you can use annotations to link people to different parts of that HOA. Any thoughts on that as a money saver?
No one?
Well, I was going to say, I agree with Todd on this one. I think that it's getting cheaper and cheaper to do this. I think we need to embrace the technology. This technology is so great because you can just sit here, and if your quality is halfway decent on your camera, just go ahead and record it. Stick it on YouTube, then you have it. It's not a whole hire a big videographer and take care of things anymore. We just need to learn how to embrace the technology and do it. You're up.
Well, I was going to ask Lee, because they've got thousands of videos on YouTube, and I often thought that it might be good to have, and I wish maybe if Google's listening here, they could take note of this, that it would be nice to be able to kind of subdivide YouTube channels to categories. And I know you can build shelves and things like that, but it's a little cumbersome and complicated right now. And it would be nice to simplify that process rather than having to create a specific YouTube channel for Mayo Cancer, Mayo, everything else that Mayo does, and have 170 Mayo YouTube channels, to have one YouTube channel that then can segment off. I agree, though. I think that Google Plus is one example, but there's a lot of low-cost ways, and I think that's one thing where you guys have done some great work at Mayo in really using these platforms to their maximum advantage.
Yeah, I mean between flip cameras, so the Hangouts on air. This is an amazing thing from my perspective. It's really cool to be able to have multiple contributors organized at one time, and then creating a YouTube video out of that. I think that's great. I think there's an increasing acceptance. I don't know if it's even increasing anymore. I think it's just there. That video of this quality, which is just coming from a webcam, is perfectly fine. It's the content that people are caring about. And I wouldn't be for us having several different YouTube channels. Anyway, we do create playlists. But another way that we handle this is by creating blogs where we embed the videos. And so we can organize those in that way and get some additional search optimization coming from that. So I think the fundamental technology of creating video with a low-cost camera, whether it's a webcam or a consumer-grade video camera, it's here to stay. It's going to grow, and that actually can, as I mentioned, just radically drive down the cost of production. Now there's the labor involved in moderating comments or monitoring comments and responding in that way. And that's something that we at Mayo Clinic can do for our physicians, that some of the physicians that are out there on their own have more difficulty. I mean, if they're doing it themselves, that can be a real time drain. But if they can, I mean, I'd be interested in finding ways to have physicians banding together, and assuming that no antitrust exemption or anything would be needed on this, but to be able to provide some common platforms maybe where good quality content can be accessible and embedded and be seen as trustworthy.
But then, Lee, there's also the question of how does that content, which is easier than ever before to make, get to the audience? How does it not get lost in just a sea of everybody's doing it? And how do you find the good stuff? The curation becomes a challenge, and also just getting this information to audiences when audiences are no longer going to destination sites so much. Yes, they will go to mayoclinic.com, as I do, but I mean, people are getting their information from friends on Facebook or from a tweet they see on Twitter or what have you. And if you're not very much involved in social media, if a tree falls in the forest, no one's going to see your video about colonoscopy or whatever. So it becomes a bit of that is time consuming just to be a personality in social media, to be recognized, so that when you do put out good content, people see it,
Yeah, I guess I would just say that what it sounds like Todd might have been working on, and what I've seen with some people like Dr. Natasha in Kansas City with Dr. Wendy Sue Swanson, and certainly they've got Personality Plus, but their main focus is on their own patients, on serving their own patients. And if you are a physician who already has patients, and if you can look at this as a way, as Todd's talking about, or making that conversation more productive and meaningful when you're in the office, that you don't necessarily have to have broad marketing kind of reasons for using these tools. It's more about being able to have more time with your patients, reclaiming the time, saying some things once on camera, and it isn't that you don't ever have to repeat it in the office, but maybe you can you can at least reinforce it. I would just tell a little personal story. I had a mole removed up here, and I was concerned that it was going to be melanoma. And my dermatologist here told me what I need to be looking for when I see moles. I have no idea what she said. I mean, she told me colors that are good and colors that are bad, and I can't even really remember. And so I went to her after, because I was all thinking, I got a melanoma. It didn't turn out to be melanoma, so I was really thankful for that. But I haven't followed up on this yet, and that maybe kind of comes back to the whole need for time, because it's been several months now, and I did say at the time, yeah, I need to go back with her and have her do a YouTube video for me, so that, and it's not just to meet my own personal needs, but there are a lot of other people.
For you and everyone else.
Yeah, exactly. And as you said, Brian, I mean, when I said 400, I mean, that's just pulling a number out of the air in terms of to emphasize, it's not a 6 million view viral kind of thing that matters. It's who are you trying to reach, and how are you trying to serve them, and if if maybe the out-of-pocket cost, well, the out-of-pocket cost is really nothing to create it. It is your time, and if you allocate salaries and stuff, if you get a couple dozen or 40, 50 views, you're right, and it's likely to be the right kind of people that are going to see it, because especially if it's a longer video, people are not going to watch it. So I mean, you're sort of self-selecting the people who are going to benefit from it.
I also think that Val brings up an interesting question earlier, which is how do you get this great content out to people? And I know we only have a few moments, but Val, what we did do you see how I did that as a radio person, Kathi? I saw you smile. So Val, what we did is we went and took our content to organizations in our niche that had large followings and developed a content partnership with them. So every Monday they know they're going to get content throughout the whole week, and then they do our marketing for us.
Yep.
So
I was going to say that, Todd. One thing I think just kind of, and we might have to just, maybe I'll get the last word, or Kathi can close us out. But
you can close us out.
Well, I think that there's still some opportunity for us and sort of this community to join together. For folks like Val and Wendy Sue and Brian and all the docs out there that I could make a big long list. I actually have a list on Twitter of who these folks are, and we know that they've got great content. But if this is going to really spread, and as this next generation kind of takes hold of these platforms, there's going to be opportunity for us to aggregate content, so you don't have to make the same YouTube video that your colleagues are making all around the country, but we can use this one YouTube that we all agree is good and spread that virally. And I think that ultimately will be some really valuable, contagious content.
That was an excellent wrap-up, Brian.
Yeah, well said.
All right, well, it's time for us to say goodbye. We have some people that need to be elsewhere, so I'm just going to thank all of you in one big virtual hug for being a part of this, and I would love to pick this up with another conversation in the future. Thank you all, and have a wonderful rest of the weekend.